We're here today to announce the filing of a complaint in the United States District Court for the District of Rhode Island, brought on behalf of Rhode Island and a number of our fellow states by my colleagues, Attorneys General, to take the Trump administration to court over its dismantling of the Department of Health and Human Services. Before we begin, I want to introduce who is with me up here today. First is my colleague, where is she? There she is. Special Assistant Attorney General Dorothea Lindquist, who is part of our terrific healthcare team. There are some others in the back. She drew the short straw of having to be up here with me in case I need some additional information. Also with us to my left is Dr. Beth Cronin, who is the Division Director of Obstetrics and Gynecology at the Warren Alpert Medical School, and works at Providence Community Health Centers providing full scope obstetrics and gynecologic care. Dr. Cronin completed a residency training at Women and Infants Hospital in 2010. She'll speak about the impact of the HHS cuts imposed by the Trump administration on maternal and children's health. Dan Fitzgerald is the Director of Advocacy for the American Lung Association in Rhode Island and Massachusetts. Dan will speak about the impact of HHS cuts on the state's tobacco, asthma, and air quality infrastructure. And Paige Parks, known to everyone, is the Executive Director of that terrific organization, Kids Count. She'll speak about the impact of HHS cuts on children, the importance of programs like Head Start to Rhode Islanders. And also with us is Julian Drex. Julian Drex, who has a master's in public health from Johns Hopkins, has worked for nearly a decade in governmental public health on asthma, air quality, and housing. He'll speak about the impact of the HHS cuts on air quality and environmental infrastructure. As I said earlier, we filed today in the U.S. District Court here in Providence the office's fourth case against the Trump administration's patently unconstitutional dismantling of our democracy. This time, ignoring the will of the Congress and thus the Constitution and dismantling the Department of Health and Human Services, an enormous agency that includes agencies like the CDC and the FDA that protect and safeguard Americans every day. In fact, HHS is so broad that when I was reviewing the complaint last night and again over the weekend, it is truly astonishing how big this agency is, the extent of the work that it does, the portion of the federal budget that it comprises, nearly a quarter. It literally impacts us in ways we don't even see or know every day, but those ways that it impacts us are incredibly important. We're joined in this lawsuit by 18 states and the District of Columbia. I want to remind everyone that there are three basic principles that guide when I and this office will act when it comes to actions by the Trump administration. First, we will act when the Trump administration takes an action that causes harm to Rhode Islanders. We'll take action when that harm is caused by an action that violates the Constitution and the law, and we will act when we have standing to do so. Every one of those criteria are met here. Here's the action. As a result of the President's Make America Healthy Again executive order, which I can only describe as ironic, and a subsequent March 27th directive from Secretary Kennedy, HHS, a critical agency created by Congress, which comprises, as I said, 1/4 of the federal budget, has effectively been dismantled. When I say effectively, I mean that for all intents and purposes it has been dismantled. I by no means mean to convey that the President and Secretary Kennedy and others have effectively done anything with respect to this agency other than to dismantle it. 1/4 of HHS's staff, 20,000 employees, have been fired. Half of the regional offices, including Boston, obviously of great importance to Rhode Island, have been closed. Functions like laboratory testing for disease, which only the federal government has the capability and the ability to do, have been abruptly terminated. Agencies have gone dark. when public and private parties reach out for help and information. The administration has undeniably harmed and will continue to harm Rhode Islanders and all Americans. What does HHS do? It was established by Congress in 1939. Its agencies protect and safeguard the health and safety of all Americans. Some of its agencies, like the CDC and the FDA, are well known to Americans. Others are less well known to us, like the National Institute for Occupational Safety and Health, which prevents workplace-related injury and illness. But all of the agencies and sub-agencies are incredibly important. These components of HHS protect us from infection and disease. They protect and safeguard our food supply. They ensure the safety of our medications. They ensure that firefighters are safe on the job. They protect minors from black lung and other diseases. And as the grandson of someone who died from black lung, I know how terrible that disease is. Components of HHS ensure treatment for first responders from the ill health effects of 9/11. They support Head Start programs all across the country. They provide funding for states for public health research, monitoring, and programs. And we know already that the Rhode Island Department of Health will lose $1.9 million in funding that supports work critical to Rhode Island, and much, much more. Let's take NIOSH, for example. What do? They do research regarding occupational safety and health. They identify toxic substances and set safe exposure levels for workers. They contract with states to provide compliance inspections for employers. They include the Office of Mine Safety and Health. They operate labs in Spokane and Pittsburgh, and the one in Pittsburgh is the only one that is authorized to approve respirators used for healthcare and mining. It operates the World Trade Center Health Program that assists the healthcare and treatment needs of 9/11 first responders. This critical agency has been completely dismantled. And on some of the slides that you'll see behind me, you'll see a before and after status of this important agency. Nearly all of its employees have been terminated, and the Pittsburgh and Spokane Washington labs have stopped operating. What's the specific Rhode Island impact from dismantling of the CDC and other HHS agencies? Well, I already mentioned the $1.9 million in grant funding. Tobacco use reduction work, environmental public health tracking, asthma control, suicide prevention, maternal mortality, substance use disorder prevention and treatment work, cancer screening, and many other things that I could spend all afternoon going over. But the bottom line is that these reductions or eliminations in services have been chaotic, with little or no warning, leaving the states left to attempt to fill the gaps, like, for example, conducting disease testing in a lab in New York that the CDC has simply stopped doing. This dismantling of HHS has and will continue to harm Rhode Islanders in significant ways, including ways that we cannot yet foresee. And all of it violates the Constitution, because the Constitution only allows one branch of government to act in this way, and that is the Congress. The Congress created HHS, and only the Congress, by passing laws, including budget laws, can expand or reduce its functions, the same promise by which HHS has developed over the past 90 years. The President's conduct violates the separation of powers doctrine, the Appropriations Clause of the Constitution, and the Administrative Procedures Act. And this action is entirely consistent with its other attempts to sideline the Congress. The same unconstitutional sidelining of the Congress that underpins the 3 other cases that we have filed in this district, in the District of Rhode Island. This office will not be silent when the President violates the law. We will not stand by, hoping that others will lead and act forcefully on behalf of Rhode Islanders. We will act and we will fight to protect Rhode Islanders and Americans all across the country. We will fight, we will act to uphold the Constitution and our democracy, because that is truly what is at stake here. Our founders framed a government with 3 branches of government, all competing with one another in terms of power. It is that competition, that pressure, that tension amongst the 3 branches of government that preserves our democracy and keeps us free. And when the president sidelines the Congress in this way, what he is doing is eliminating effectively one branch of government. When he undermines the judiciary, as he has done repeatedly, as this office, with my colleagues, has piled up wins in court, what he does is take all power to himself. And that is why these actions are so important. And we will continue to bring them as long as the president takes action that harms Rhode Islanders, that violates the Constitution, and allows us to act on behalf of the people of the state. And so with that, I will turn things over for the moment to Dr. Beth Cronin. Thank you.
Hello, everyone. My name is Beth Cronin. I'm the Rhode Island Section Chair of the American College of Obstetricians and Gynecologists and a practicing OBGYN here in Providence. I'm honored to be here today to help highlight the impact that the decisions and cuts by this administration will have on maternal and child health for all Rhode Islanders. In late March, when HHS eliminated the Division of Reproductive Health, this led to some unforeseen changes. This division oversees the study of health and well-being of pregnant people and their babies. This division oversaw the Pregnancy Risk Assessment Monitoring System, or PRAMS, which is a population-based surveillance system to identify groups of women and infants at high risk for health problems, monitor their changes in health status, and measure progress towards goals in improving the health of mothers and their infants. This data, in turn, is used by organizations to apply for and obtain grant funding to fund statewide health improvement initiatives. The DRH is also responsible for running the Pregnancy Mortality Surveillance System, which is a national surveillance of pregnancy-related deaths in the United States. This program helps support our state's maternal mortality review committees, and I want to address why these cuts will continue to negatively impact Rhode Islanders today and in the future. Pregnancy-related complications result in approximately 700 deaths each year in the United States. Additionally, for every pregnancy-related death, there are 70 severe maternal morbidity events, or unexpected outcomes of labor and delivery, that result in significant short or long-term health outcomes for these individuals. These maternal health disparities significantly impact Indigenous and Black women. Approximately 2 to 3 times higher rates have pregnancy-related mortality compared to white women. We need this data to be able to address these disparities. We cannot cut funding to programs that work to identify these causes without disastrous long-term consequences. MMRCs are multidisciplinary state or local level groups that provide comprehensive review of deaths that happen during pregnancy or within that first year postpartum. The data that results from MMRCs are one of the most powerful tools we have to identify evidence-based approaches to saving lives. They help us do a deeper dive into pregnancy-related deaths by reviewing data from a variety of sources, such as autopsy records, informant interviews, identifying clinical and non-clinical factors that contributed to each of these deaths, and helps us to create a more comprehensive picture of how these deaths occurred. By understanding pregnancy-related deaths, we can then create more comprehensive recommendations and strategies for preventing them and the morbidity that goes along for all those other patients. Without these data, we will be in the dark for how to improve care and prevent these outcomes for Rhode Islanders for many years to come. For more than a decade, ACOG has worked collaboratively with innovative partners across the field of maternal health to help identify ways to save lives. We are still in a maternal mortality crisis, and it is critical that MMRCs have funding to support this uninterrupted review process and access the necessary resources so that we can continue to take the very best care of our patients. Thank you.
Thanks, Doctor. And next, I'd ask Dan Fitzgerald to come up. Thanks, Dan.
Hello everyone, my name is Dan Fitzgerald. I serve the American Lung Association as the Director of Advocacy here in Rhode Island. I stand before you today representing the 35 million people living in America with lung diseases. That includes over 187,000 Rhode Islanders. As a direct result of the Trump administration's elimination of staff and funding at health and human services agencies, such as the Centers for Disease Control and Prevention, we have seen critical programs such as the National Asthma Control Program and the Office on Smoking and Health be eliminated, and they're causing irreparable harm. The funding that is being taken from our state are funds that Congress already appropriated and the president signed into law. It's not only a bad policy decision, but not legal to do so, as you just heard. That is why it is so very important that Attorney General Neronha and his fellow attorneys general are taking action and fighting back. Eliminating these programs not only undermines decades of public health progress, but it threatens to place an even greater strain on our already overburdened health systems. Let me be clear. Cutting funding to these programs will have a negative health impact on lung health. These cuts will lead to more kids suffering from asthma attacks and ending up in our hospitals' emergency departments. They will lead to more youth becoming addicted to tobacco products, and it will lead to fewer people successfully quitting once and for all. The Lung Association here in Rhode Island has already lost funding for asthma and tobacco control program work from the federal government, eliminated with no notice. These drastic cuts immediately halted life-saving programs and have resulted in extreme reduction in our ability to respond here in Rhode Island. The leading cause of chronic absenteeism in Rhode Island schools is asthma. Providence was also found to be of the top 10 most challenging places to live with asthma. All of this will be exacerbated by these federal slashes to asthma control programs and environmental protection efforts. Just last week, the Rhode Island Tobacco Control and Prevention Network was decimated. These federal cuts immediately stopped programming that was directly funding Rhode Island public schools in their efforts to fight back against the youth vaping epidemic. They were implementing evidence-based quit programs and alternative to suspension programs that were keeping Rhode Island kids in school while addressing and improving health outcomes. These funding cuts immediately halted public education campaigns, prevention programming, and it has all but eliminated support for Rhode Islanders who need help quitting. Let's not forget that commercial tobacco use remains the leading cause of preventable death and disease here in the United States and in Rhode Island. Here at the Lung Association, we know that when you cannot breathe, nothing else matters. These actions by the Trump administration are decimating our public health infrastructure here in Rhode Island and across the nation. So I'd like to say thank you to Attorney General Neronha for his efforts in trying to restore these vital programs. Thank you.
Thanks, Dan. Next, Paige Parks from Kids Count. Just give me a second here, Paige.
Thank you.
It's good to see you.
Thank you, Attorney General Neronha. So good afternoon, everyone. I am Paige Parks, Executive Director of Rhode Island Kids Count. And Rhode Island Kids Count is a statewide children's policy and advocacy organization dedicated to improving the health, safety, education, economic well-being, and development of Rhode Island's children, with a core focus on equity and eliminating disparities based on race, ethnicity, income, immigration status, disability, neighborhood, and zip code. This afternoon, my remarks are about Rhode Island's children and the impact of dismantling HHS and any changes to federal funding and what it would have on the important programs that many of our Rhode Island children depend upon. Decades of research have shown that high-quality preschool programs help children gain academic and social-emotional skills prior to school entry and can produce positive outcomes that last well into the school years, including reduced need for special education services and improved high school graduation rates. Learning disparities, they appear early and grow over time without access to enriching early learning experiences. Now, participating in high-quality early learning programs from birth through kindergarten entry helps to ensure children enter school with the skills needed to succeed. Without government funding and support of HHS, children from low-income families and Black and Latino children would have less access to high-quality preschool compared to higher income and white families. Head Start programs deliver early education, dental, medical, and mental health supports, nutrition services, developmental screenings, and also help families by having them involved in program decision-making, helping to build parental skills, and supporting their entry and retainment in the workforce. In October 2024, there were 1,438 children enrolled in Head Start, and there were 493 eligible children on a waiting list for Head Start. Rhode Island Head Start programs score above the national average and significantly above research-based thresholds for emotional support and classroom organization, and meet research-based thresholds for instructional support based on classroom observations and teacher-child interactions. It's also important to note that Head Start is an integral part of Rhode Island's early learning system and the Rhode Island pre-K delivery system. 40% of Rhode Island pre-K programs are administered by Head Start agencies. If Head Start collapses, it leaves our early learning system even more fragile. It's kind of like when you play the game of Jenga and the stack is really fragile. The last thing you want to do is to pull that block in the middle that's on the bottom because it is holding up so much. And that is what our Head Start programs are in Rhode Island. Rhode Island Kids Count supports federal and state investments in Head Start. In fact, Rhode Island is one of 14 states and Washington, D.C. that invests our own state funds into Head Start and early Head Start to serve more children, support more competitive teacher salaries, and help programs meet their federally required 20% match. We cannot lose this incredibly important program, and not only helps to build the futures of children and their families, but it's critically important to all of our futures. Thank you so much.
Thank you, Paige. All right, next, Julian.
Hello and thank you. My name is Julian Drex. I work for an organization called Human Impact Partners. We are a national health justice organization. HIP transforms the field of public health to center equity and build collective power with social justice movements. Prior to that, I worked at the Rhode Island Department of Health for 8 years. Most of my time there was leading Rhode Island's asthma program, funded through the National Asthma Control Program at the CDC. I worked closely with the people and institutions at the state and federal level who do the everyday life-saving work of environmental public health. When COVID hit, I was asked to serve in a leadership role in Rhode Island's COVID response. At that point, we are defending the public's health from a deadly virus, and our efforts were made worse by the first Trump administration's mismanagement. What we did have at that time, though, was funding and people to do the necessary daily life-saving work of public health. Today, unfortunately, we are defending public health itself, and the attack is not from a virus, but from the direct attacks by this administration to dismantle the national public health infrastructure. Unfortunately, public health is not well understood, even after what we went through collectively with COVID. Where healthcare and doctors and the healthcare facilities treat individual patients, public health focuses on treating and supporting the health of entire populations. Public health is about shaping the conditions that allow everyone to thrive, and that involves every policy, every structure, and every cultural input that touches our lives. Health equity means that everyone should have a fair and just opportunity to be as healthy as possible. And in order to achieve this, we need to remove obstacles to health such as poverty, racism, discrimination, and lack of power over decision-making. During my time at the Rhode Island Asthma Control Program, some of the work that we did was to track and produce data around asthma. Who has it? How severe is it? What are the disparities by race, by age, by geography, and many other important factors? The funding and the staff for programs are necessary to address the highest need. Programs like asthma home visits for children who have been hospitalized for severe asthma, to be able to have nurses and community health workers who can go to their homes and identify and remove asthma triggers that are in their environment. Environmental public health tracking systems track disease that is caused by and impacted by impacts of our environment. Not to mention climate change, which is a risk amplifier that takes all the other stressors and inequalities in our system, amplifying them and making them worse. These are critical, important, life-saving infrastructure for Rhode Islanders, a state that has consistently been in the top 5 for asthma rates for the past many years, and which has deep disparities by race, with asthma particularly impacting Black and Latino children in our urban core cities. We need government to be able to provide support and protection and to produce the data. Our program at the Department of Health produced the data on asthma that was shared with Kids Count for their annual fact book that was released this year. That data doesn't exist out of thin air. It is created by people. It is created through programs that do the important work to tell us what is impacting us, what diseases are impacting people's health and at what rates. In the first Trump administration, there was a point where he suggested getting rid of testing, because the data that COVID is out there was a problem for him, and he wanted to make it go away. But getting rid of the data doesn't make the problem go away. It just makes it less inconvenient for those in positions of power who stand to benefit from making people sick. Governmental environmental regulations and protections are the only thing protecting us from the industries polluting the air, water, soil, and food that all human health depends on. They will not protect us on our own. The market has never protected us by itself. We need government, and strong protective government that is accountable to us, not to industry robber barons, who Trump is accountable to. So thank you, Attorney General Neronha, for standing up and fighting for the public's health.
Thanks, Julian. You know, when I think about this case, and everybody, when I think about this case, it's really about, in part, funding, because certainly we want the funding to continue to flow, but it's dismantling of the expertise that is equally, if not more, concerning. You know, I guess this is what one should expect, we should expect with this president, and when he put somebody like Secretary Kennedy in charge, who is a conspiracy theorist and a tinfoil hat science guy, frankly. I'm thinking of my friend Senator DePalma. He always talks about give me the research, give me the data. We are effectively going into a time when our public health will be based on happenstance and not on data. And that is a real concern. Public health is getting ahead of a problem and addressing it, but also getting ahead of it. And these cuts to these agencies are really going to impact our public health system in a negative way that we may not see right now. We may not all see it right now, but it's going to impact all of us. And you know, a lot of the examples I used in my remarks about 9/11 first responders and mine workers, you know, we don't have a lot of mine workers in Rhode Island, but they're Americans. And they deserve a public health system that will work for them and protect them. And when you can't get a respirator approved, and you go on the website for applications to get a respirator approved, and the language says, well, it's in the complaint, well, you know, we're not handling applications because everyone's been fired, effectively. That's pretty much what it says. It doesn't say very much about this president's and Secretary Kennedy's appreciation of what public health means. And so this case is, it's a long complaint. It's 99 pages and it takes a while to get through. even if you are a lawyer and likes reading that kind of thing, and frankly, there are some lawyers who don't. But you can lose in that sea of trees, the forest. And what the forest is telling us is that we're in trouble. And so I'm grateful to my team here that's working really hard on these cases. They really are working really, really hard. And it takes a lot of them to do it collectively. So I'm grateful to them and Dottie, who's here with me, who worked really hard on this case in particular. And my fellow attorneys general. We have built the best and biggest law firm in the United States. We talk 3 times a week as attorneys general to one another. We are, as I've said before, neither shocked or awed by the president's chaotic form of government, and where we continue to see harm and violations of the law, that we're going to act on behalf of Americans and Rhode Islanders. And so with that, if there are any questions, I'm pleased to take them.
How long do you expect this case to take to move through the process?
Ian, I expect that there will be some motion practice very soon with respect to the harms that we allege here in the complaint. I don't want to get over my skis too much on that, but I expected that to come very quickly. I think you'll see more specifics from the various states, even more than what's in the complaint, more than what we've talked about here as to how they're impacted. Look, everything in the district court everywhere we've prevailed already, there's always an appeal. So I imagine we'll get some early action by the court. I hope it'll be in our favor, and if it is, then I imagine there'll be some appellate proceedings that proceed from there. But if you're asking me for a date where we'll have some knowledge as to where we are, I would say within a month.
Steve Bannon talked about, in his view, the Trump administration should flood the zone. You said this is the 4th case you brought.
Yeah.
How concerned are you that with the variety, cumulative efforts of the Trump administration, that a lot is going to happen by the time this court process reaches a conclusion?
Yeah, well, the great thing is, Ian, that in all of our cases to date, we've gotten a preliminary injunction relief. So the Trump administration has been effectively stopped in its tracks. So I've heard that in a couple of other places, and I think what needs to be remembered is after we bring these cases, we're seeking injunctive relief or a temporary restraining order. In some cases, haven't done that yet here. That may come, but we've won every one of those. So, for example, the $31 million of public health funding that was endangered in Rhode Island, that money continues to flow. All of the money that was impacted by the original OMB freeze, that money continues to flow. In our cases in Massachusetts involving NIH funding, that money continues to flow. So Mr. Bannon is wrong in thinking that no one can stop the president. We've stopped him, and we're going to continue to stop him because we're right on the law. These cases, frankly, are not difficult ones, provided that the laws are upheld. Birthright citizenship, great example. Why anyone thinks the 14th Amendment can be changed without a constitutional convention, given the clarity of that amendment, I don't know. But we're going to continue to win. And when we win, Ian, it's not about winning in 3 years. It's about winning within a week or a month, or in some instances, in some of our cases, within a matter of 24 to 48 hours. So the office has been very successful here in Rhode Island, and our colleagues together with this office have been successful elsewhere as well.
You're pushing back on the characterization that the HHS is putting here for this, they're calling it a restructuring. They're saying that this is going to streamline processes, that
Sure.
this is going to, save taxpayers $1.8 billion a year. What's wrong with that?
And it may kill a lot of them. May kill a lot of that, a lot of those Americans, those taxpayers. Here's why. There's a lab at the CDC that does some disease testing. It's not doing it anymore. Did they get somebody else to do it before they stopped doing it? No. New York is trying to fill the gap, but they can't fill that gap alone. These actions may save money, but they're going to kill people. They're not going to kill people like Donald Trump. He's going to get the best health care in the world. I read in the newspaper today that they are redoing some of the infrastructure where Congress goes if there's a real federal emergency. I don't know if that's a coincidence or not. But the bottom line is the president can go off to Cheyenne Mountain when he's got a problem. The rest of us can't, okay? So, yeah, it may save money, but it may kill a lot of Americans too. I still think of those 800,000 Americans okay, for whom a flag was planted on the Washington Mall when I visited a couple of years ago. They're dead. They're dead because we weren't ready. They're dead because we didn't have enough equipment to take care of Americans. They're dead because we didn't have enough respirators. They're dead because we weren't prepared. And Americans are going to be dead going forward if we cut HHS the way we are doing and we're not prepared for the next healthcare emergency. Like kids dying of asthma or going to school with asthma, it means something. I'm not willing to save money on my taxes so that more kids in Rhode Island can get asthma. We're either a people that cares about our collective health care or we're not. I'm somebody who does. And I think a lot of Americans agree. Any other questions?
Yeah,
Go ahead, Steve.
Yeah, I do. Given the lack of data that we're gathering now, how are we going to know about these irreparable harms? I mean, we're not going to be able to see.
Yeah, we'll
the
know.
extent
We'll
to
know
what they're
when we
back.
have measles outbreaks that are more than just some important to some towns in Texas, but when it spreads across Texas and into New Mexico and beyond. That's when we're going to see it, Steve. We're going to see it in the results of Americans getting sick or dying. That's when we'll see it.
Right.
That, this is all about preventative health. I mean, the doctor can speak to this. This is about preventing bad healthcare outcomes. When we file our federal taxes, there is no question that some of that money comes back to us in other forms, and we've talked about that in the funding cases we've done. We file our federal taxes, we all do, it goes to Washington. Some of it goes to operate a federal government, defense, that kind of thing. Some of it comes back for bridges and healthcare and education and all that. But some of it is there because only the federal government can do certain things. When I was U.S. Attorney, and I'm wearing my U.S. Attorney pin in solidarity with the members of the Department of Justice, the career workers who are being undermined by this administration too, and have made it an embarrassment to be an alumni of the department. We're only going to see the outcome of these bad decisions, these chaotic decisions. I mean, in the complaint, there's a reference to the secretary saying, we laid off a bunch of people, but we know we're going to make mistakes. We're going to hire them back. How is that good policy? It's not, obviously. As the old phrase goes, it's no way to run a railroad, and yet this president continues to operate in this way. That's why, we have to continue to build our team here. Our healthcare team, Dottie is one of how many?
3.
One of 3,
4.
yes, 4. And a few others that jump in when we need them. That's more than double the size when we started. That wasn't built to deal with Donald Trump. That was built to deal with our healthcare challenges here that we've talked so much about and continue to emerge and become acute. Again, as the doctor knows, but it's really important that we continue to build our team because we bring that expertise to these fights. And I have to say I'm grateful, remain grateful to the late Senate President Ruggiero and Speaker Sicarci for their support of the office. If we had not been given the resources to build this office, we would not be able to protect Rhode Islanders in this way and others. So I'm really grateful for that. Any other questions?
I did want to ask about exactly, we're dealing with a primary care shortage here in Rhode Island. Do we see that these cuts could be directly affecting how Rhode Island is able to respond to that?
Well, the doctor may have some thoughts on that. I mean, I don't have any beyond this. That I know one of the things that we have encountered, and you'll hear more from us, relatively shortly about some of the studies we've done about primary care. Data is really important to understanding what the problem is and how you fix it. If you look at the surface, for example, primary care data, even the expert that we hired to look at primary care looks at primary care and sees by the numbers that we have a lot of primary care doctors in relationship to our fellow states, but we know that that's not true on the ground. And so that disparity between what the data shows us, in that case not very good data, and what the everyday experience of the Rhode Islander is what causes I think a disconnect in the first place, but also gives state leaders an out when it comes to fixing the problem. Until you know the extent of the problem, you can't fix it, and B, you can't convince people why it's so important to fix it, right? Like, it's very difficult to fix a public problem if leadership isn't able to or can't convince the public that it's as big a problem as it is. And primary care is a problem that requires resources. And until we accept that healthcare, including primary care, is something which should be at the beginning of our conversation about how we spend our state budgetary resources, we're not going to fix it. Right now, we think of it as optional. And unfortunately, a lot of Rhode Islanders are feeling the fallout from that. It's a great question, so thank you for it. Doctor, do you want to weigh in on primary care, or do you want to stay to OBGYN?
Yeah, I'll stay in open. No, I mean, I think it's exactly that, right? We need the data, and we need
Do you
data.
mind coming up to the mic?
Oh, yeah.
Sorry.
No, I think we need data to be able to actually dissect and understand what these problems are. I think the primary care shortage in the state, having sat at a House Finance Committee meeting last week and understanding kind of what my primary care colleagues are doing and faced with, we need, it's not just a funding issue, right? Like, we need to better understand this, and I think this is where, as we dismantle some of these various organizations whose job is to get us this data, it's incredibly difficult to figure out how to move forward.
I do have a question for the American Lung Association. You mentioned to me, to the group here that you guys have already received federal cuts. Could you give us a better number of that and how that compares to your overall budget here in Rhode Island?
Sure. Here in our Providence office, we have seen reductions in nearly all of our grant funding here. Much of that was federal funding that passed through the Rhode Island Department of Health that halted after these cuts federally.
Do you
But
have a good number, or
I don't have the exact number off the head, but happy
like
to circle back.
percentage-wise even?
Nearly 100% of our grant funding as of last week has been eliminated in Rhode Island.
All federal.
Yes.
All federal. Nearly 100%.
Yeah. And those are programs dedicated to assisting residents in Providence with, children with asthma. It was around indoor and outdoor air quality, and the statewide network around tobacco control, prevention, and quit resources.
And how much does your organization rely on federal funds, like percentage again, if you could?
I don't have an exact percentage nationally, but certainly a large portion of our mission impact here in our state relies
Almost like
on
the majority.
funding.
If it is a majority a good term to
Sure.
use here? Yeah. Thank you.
Thank you.
Can I speak to the
Of
primary
course,
care? Oh,
yes.
Thank you. Also, to your question about the primary care providers, there are proposals now being heard by the General Assembly that would increase rates, or at least propose a rate review for primary care providers. And the governor does have in his proposed budget a small bucket of money for a loan repayment program for primary care providers. And Rhode Island Kids Count is supporting both that proposal as well as additional bill that would require a rate review for our primary care providers, because so many of our young children are on Medicaid, right? And so of a primary care provider, if that rate is too low, it's going to directly impact how many kids have availability and access to that really important primary care. So I can give you those bill numbers if you're interested.